You've had a blood test called a hepatitis C antibody test, and the test has come back positive. This means the test found hepatitis C antibodies in your blood. At some point, you've come in contact with the hepatitis C virus. Hepatitis C is a virus that lives in the blood and can have serious effects on your liver, even causing cancer. Around 1/4 of people clear the hepatitis C virus on their own. Unfortunately, even if they do fight it off naturally, they can get it again if they put themselves at risk. There is no immunity to hepatitis C and no guarantee of being able to clear it a second time. Your doctor or health worker will have to do another test to see if you have the hepatitis C virus. This is called a PCR RNA test. If this test is positive, it means that you have the hepatitis C virus, and without treatment, it will be there for life. They will also discuss with you about when you think you may have contracted the virus.
So what will happen to me?
Most people living with hepatitis C don't feel sick for a long time, but slowly, over many years, they may get tired, run down and unwell. This can make life a lot harder to live and sometimes is very serious, even deadly. The good news is there's now a very effective cure that you can get from your doctor. There are new treatments to cure hepatitis C, and around 95% of people on treatment will be cured. Just be aware, even if you clear it or it's cured, you can still catch it again.
What is the treatment?
For most people, all it takes is one pill a day for 8 to 12 weeks and a few simple blood tests along the way. It's very important that you take your treatment every day until you complete the course. Unlike previous treatments, there are very few side effects. During treatment, your doctor or healthcare worker will do a blood test to see how you're going and if it seems to be working. After 8 to 12 weeks, you'll have finished your medication and you'll have another test which we hope will confirm your hepatitis C is gone. The doctor will want to see you again a few months after taking your last tablet. There will be another test called an SVR test. This is the most important blood test, as this is the one that tells us if you're cured. But remember, this is a cure, not a vaccination, so you can get hepatitis C again if you put yourself at risk. If you become reinfected, that does not exclude you from further treatment.
How do you get hepatitis C?
Hepatitis C is only passed on through blood-to-blood contact. Most everyday activities do not pass blood from one person to another. Just living, working and being around people who have it is not a risk. The most common way of passing on blood is by sharing any equipment used for injecting drugs. And you can get it from using unsterilised tattoo and body piercing equipment, or sharing razors and toothbrushes and ceremonial tools. So basically anything that passes infected blood from one person into another.
How do I stay healthy?
To make sure that you're cured, you must take the pills every day for the time your doctor says and have your blood tested when it's needed. Stay in contact with your doctor or healthcare worker. They're here to help you follow the treatment and answer any questions. Don't share anything that can pass infected blood from one person to another. And we all feel better when we eat well, exercise and cut down on the grog. Your liver will thank you for it. You can always call the people at Hepatitis WA on these numbers. And remember, there's always care and support for you when you need it.